He was my water delivery guy for a store that I ran in Watertown, jewelry store. I'd see him once a month, say hi, that was it. And then one day, we had a special event at the store and I was wearing a red silk dress and that was it. It just seemed like there wasn't even a question. Like I was the one for him and that was gonna be it. And it was true. We're married. I decide I'm gonna go to nursing school and I'm pregnant. 3 redheaded babies in 15 months' time. And then Amanda came into our life. We bought this house and we've been here ever since. Paulie went first and then Kevin and Brian went to school as well. So for the first time in who knows how many years, the house was quiet, it was clean, and he really struggled. And of course, we're doing exactly what we're supposed to do. Those kids graduated high school. They're supposed to go to colleges. They're supposed to travel. You know, I was ready for this part of my life. You know, and that became a big strain for us. So around that time, I said, listen, we have to talk. We were out in the yard. It was gorgeous. We were on the swing. You know, I said to him that something was wrong. Like, what can I do? He just kind of looked off. Now I'm getting tearful because I'm like, do you just not know how to tell me that we're done? Nothing. And I start to cry. And gets up off the swing. He walks into the house, shuts the door, and locks me out. So I'm sitting there sobbing, and I'm like, oh my God, what just happened here? I get up and I go in the house, and he's watching TV. Totally not affected by anything that just happened. And that was absolutely not him. And then that's where it all started. We saw a neurologist because he was forgetting things and he was struggling at work, and he went on an antidepressant and it didn't touch him. And at the same time, so he's getting counseling, scans, neuropsych eval, because I'm pushing them and pushing them. And I said, I'm not saying it as a nurse, I'm saying it because I've been with this guy since I was 21 years old. There's something wrong. Our neurologist happened to be pregnant. She said she was gonna go on a leave, and she goes, we gotta do something. I said, great. She goes, let's get a PET scan. And I'm like, you think he has cancer? And she said, no, but we need to probably just look at it. And I go, absolutely, let's do it. We get the results a couple days later, and she's like, well, it's abnormal. And I go, oh. And she goes, well, your husband either has frontal temporal dementia or he has Alzheimer's. And I'm like, okay, that wasn't really on our radar. We get the diagnosis, you know, sometime later that it was more Alzheimer's than FTD. And now I'm like, okay, let's go. What's next? So Paul went to work the next morning. I sat here and had a good old-fashioned cry for myself, and I really didn't know what to do. So I called the Alzheimer's Association, and I get this wonderful woman on the phone, and I feel like I've got it together. I'm like, okay, what do I need to do? And so she tells me, I'll send you the package, take a breath, we're gonna help you. She was so supportive, and I'm sobbing and I'm sobbing. She's like, oh my God. I go, wait, just give me a second. And I pull it together, I'm like, okay, go, what's next? And literally, like a checklist, I went through it without even thinking about it. I just trusted this person on the other end of the phone, who obviously knew way more than me. And, you know, since then, I've called when I have a thought at 2 o'clock in the morning, if I haven't slept, and I'm like, what do I do next? It's everything. It's from financial questions, it's our future, it's long-term care questions. I don't know what I would have done without that support. He's changing every day. It's very different than it was, you know, just a few months ago even. I do all of his care, get him in the shower, I get him fully dressed. Shaving is quite a challenge, but he has to look good. Like, I have to have that man looking good, because he was like that. And the whole time he's talking to me like, what are you doing that for? Where are we going? I know what I'm doing, Nikki, I can do this. But then he can't, and he doesn't. And so I just say, of course you can, but let me just do this thing for you. As he progresses, my biggest concern is that he become unsafe. And as he is getting so much worse just in the last few months, I called the Alzheimer's Association the other day and I said, how do I pick a long-term care facility? They think he's ready now, and I'm just not. But I don't want him to get hurt because I kept him home longer. And I feel like, you know, when he goes, like, he's not gonna last very long. So for me to say, okay, it's time, I almost feel like that's me saying. He does have these periods, and from what I understand, other people have them too. You know, it just poof, he's there and then poof, gone. But I'm telling you, he was there for a minute. I didn't even have to see him. He said, hey, baby, and I was like, hey. like just the way he said it. And I was driving and he put his hand on my leg. I'm like, oh my God, he's here. I was just so glad that I thought to ask him right away. I said, Paul, is there anything we haven't done? He's like, what? And I go, anything. Anywhere you want to go, any place you haven't seen with me, anything you want to do. And I thought I lost him, but he was thinking. And he looks at me and I'm trying to drive the car and he's like, I just want to spend the next 30 years with you. And I'm like, okay, that was too much. And I said, we don't have 30 years. The doctor just told me I only have 6 months. So like, what do you want to do? And he kind of chuckled. He goes, it's just as long as I'm with you. And that was it, he was gone. I'll wait for the next one, you know, and see what I get. And so you live for that.
Hello, my name's Alicia Dorman, and I want to thank the leadership at the Sons and Daughters of Italy in America for allowing us to join the meeting today. We wish we were with you in person and look forward to that day. The family featured in the video you just watched is just one of the tens of thousands of families the Alzheimer's Association helps each year through our care and support programs. I'm very pleased that my colleague Sam Fazio was with me today to provide you with an update on some of those programs. But first, I want to thank all OSDIA members for your unwavering and generous support. Since 1995, your organization has supported the association in our mission to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Through generously giving of your time, raising awareness, and raising over $1.7 million to support our mission, the Sons and Daughters of Italy in America are making a difference for those living with the disease today and fighting for effective treatment and prevention for tomorrow. We are so very grateful for your partnership. Before I turn things over to Sam, I'd like to share something I think you'll appreciate. Early last year, music legend Tony Bennett shared the sad news that he's living with Alzheimer's disease. The Alzheimer's Association has worked with Tony's family to raise awareness, break through the stigma surrounding Alzheimer's, encourage important conversations about seeking a diagnosis, and to help families access care and support services. In December, we released a public service announcement video highlighting the decade-long friendship and bond between Lady Gaga and Tony to raise awareness of the association's resources available for families facing the disease. Tony appeared on the cover of the winter 2021 issue of ALZ, the magazine of the Alzheimer's Association, and that cover appeared on the back of the December 6th issue of Time magazine. The association consulted with CBS's 60 Minutes segment that highlighted Tony's life with the disease and his preparation for his final two performances at Radio City Music Hall with Lady Gaga. And in honor of World Alzheimer's Day, Tony created a Facebook fundraiser to support the work of the Alzheimer's Association. I hope you know that you're in good company. And now, it is my pleasure to introduce another outstanding Italian-American, Sam Fazio. Sam is Senior Director of Quality Care and Psychosocial Research at the Alzheimer's Association. Sam, I'll hand it over to you.
Thank you, Alicia. I'm so happy to be here with you today, even if only virtually. I'm going to talk about how care and support research helps the Alzheimer's Association achieve our mission goal of maximizing quality care for all affected by Alzheimer's and other dementias. But first, I'd like to provide a little background for those of you who may not be familiar with our cause or our organization. The Alzheimer's Association has been providing help and hope for those facing Alzheimer's and other dementia for more than 40 years. Our vision is a world without Alzheimer's and all other dementia, and to that end, we have become the global leader in Alzheimer's research, with your organization's generous support. We are equally committed to providing and enhancing care and support for those who are already facing the disease. More than 6 million people currently living with Alzheimer's in the US, and 11 million people are serving as unpaid caregivers to family members and friends living with dementia. Perhaps some of you are among those numbers. Last year, the Alzheimer's Association provided care and support more than 7.5 million times through a variety of channels, including our website, our helpline, and our community programs. As the population ages, the number of people requiring dementia care and support is growing. We have two imperatives: One, care and support must be high quality, and more people must have access to it. That's why our care and support research is so important. The Alzheimer's Association has always known and heard from others that our programs are making a difference. But now, through our care and support research efforts, we are able to illustrate the evidence for our programs and services. Our research is also helping to develop an evidence base that would enable our programs to be replicated and delivered by other organizations. That would be dramatically important and increase access to quality dementia care and support nationwide. So let's start by looking at the support we provide for family caregivers. More than 80% of the help provided to older adults in the US comes from family members, friends, or other unpaid caregivers. And more than half of families caring for an older adult are caring for someone with dementia. Caring for someone with dementia can take a great emotional, physical, and financial toll. Nearly 60% of dementia caregivers rate their emotional stress as high or very high, and up to 40% suffer from depression. I suspect some of you know firsthand what I'm talking about. For several years, we've been exploring the impact of our 24/7 helpline, which is available around the clock 365 days a year. Our master's level clinicians and other helpline specialists received more than 245,000 inquiries last year and responded with a confidential information, care consultation, and support in more than 200 languages and dialects. Care consultation is a care navigation service offered to families at any stage of the disease process. A person living with the disease or a caregiver speaks or meets with a master's level clinician to develop a customized plan of care, and it helps guide their journey. Families receive a thorough assessment of their needs, discuss available resources and support, and learn how legal and financial plans and end-of-life decisions and more. It also includes a safety assessment. So let me tell you a little bit about that research. We examined the impact of our telephone-based care consultation on caregiver confidence, competence, stress, and well-being. We found that one call does make a difference. It makes a difference on emotional distress and confidence. We also found that the vast majority of caregivers understood the action steps that were shared with them, and they actually took action. We are now doing additional research to study care consultation in greater depth. The association is also exploring the impact of our family education programs, beginning with our newly refreshed programs. We know that for many, caregiving has a significant impact on financial health. 40% of caregivers reported paying expenses for their friend or family member caused them to cut back on their own spending, and 43% reported that these expenses caused them to cut back on saving money. Additionally, 20% reported spending money from their own retirement to pay for dementia-related expenses. And lastly, 35% reported household income losses as a result of employment changes due to caregiving. So our newly refreshed program, Managing Money, A Caregiver's Guide to Finance, has been developed to help caregivers ensure their financial well-being and better equip them to undertake financial caregiving tasks on behalf of their care recipient. The program includes topics like benefits of planning early, avoiding financial abuse, having conversations about finance, and we recently conducted a randomized controlled trial for the pilot program of 6 chapters to explore the benefits of the program before the nationwide launch. We're now analyzing that data, and the program will then be available in 3 formats: online, in-person, /virtual, and also in Spanish. We are also refreshing our Caregiver series, formerly known as the Living with Alzheimer's series. And we will conduct another randomized controlled trial to examine its impact once that is ready. We are currently in the process of developing the pilot program. Lastly, we are working with researchers at Vanderbilt University to submit an NIH grant proposal to examine the impact of our online social support platform, All's Connected. All's Connected is an online support community for everyone impacted by the disease and includes message boards and public and private groups. Now I'd like to talk a little bit about quality care in long-term care settings. Nearly half of nursing home residents are living with Alzheimer's or another dementia, as more than 4 in 10 older adults in assisted living communities. In addition, more than 3 in 10 individuals receiving home care and adult day services are living with dementia. Whether these people receive high-quality care and enjoy a good quality of life depends greatly on whether those who care for them understand their behavior, their unique needs, and their preferences. To influence quality care provided to individuals living with dementia in these settings, the Alzheimer's Association convened international experts and leaders in dementia care to develop the Alzheimer's Association Dementia Care Practice Recommendations. We now have been examining the impact of our initiatives for professional care providers to aid them in the implementation and adoption of those recommendations and how that impacts quality dementia care. So first, our online training and certification program, Essentials, was developed for professional care providers. Through a randomized controlled trial, we found that learners completed the program and they demonstrated statistically significant increases in both knowledge and confidence to care. At the same time, learners who completed the program were pleased with the experience and were highly likely to use the skills in practice. We also evaluated Project Echo, our virtual case-based peer-to-peer learning series for assisted living and a COVID focus session. In addition, we know that training alone has only so much impact, so we combined Essentials plus Project Echo for training, certification, and peer-to-peer support. We're currently piloting this effort in Washington State to see if the combination leads to added benefits. In addition, we recently submitted another NIH grant proposal working with Dr. Cheryl Zimmerman and her team at UNC to look at the impact of Essentials and Essentials plus Project Echo on job satisfaction and staff retention in more than 1,200 assisted living communities. We're really excited about the possibility of such a large project. Lastly, we are working piloting a 6-month coaching series called Care Community Coaching to make system-wide changes in long-term care. And we're doing that in 25 nursing homes in the state of Washington and 25 nursing homes in Montana. In addition, in response to the pandemic, we had the exciting opportunity to work with the Florida Department of Elder Affairs to develop Project Vital to impact social isolation in 300 senior living communities across the state of Florida. This project included 4 key components: connection, engagement, education, and support. All of this through customized senior-friendly tablets, Project Echo, and virtual and online education and support. So we found that the tablets were shown to be very effective to engage and connect residents, as well as being a useful tool for staff members. Additionally, the tablets help staff proactively connect with residents and their families without a significant impact on staff time, as well as address families' questions or concerns by allowing families to see residents through these video calls. So I am so very pleased to be able to share this work with you today. We sure have accomplished a lot over the past year, but we still have much more to do. The challenge of Alzheimer's continues to grow, but thanks to partners such as yourselves, so does our hope. We are grateful for all your leadership and all your members are doing for our cause. Thank you very much.